There you are.
Okay, hi. Thanks for joining us again for my Sister Circle presentation. Today we're going to talk about breast cancer screening. My name is Lavada Tillie. I am a family nurse practitioner. I work at Metro Health. I have been there since February 2018 in outpatient OBGYN. As of June 27th, I also became dual certified as a certified nurse practitioner as well, and I will remain in my career at Metro Health. So soon I'll be catching babies there. But today we're going to focus on breast cancer screening. In my role at Metro Health and Outpatient Women's Health, I focus on preventative care. So prevention is a big factor of what I do. Um, and we just had a presentation by my colleague and a person, and she focused more on the in-depth diagnosis and treatment. So you could refer back to her presentation for that information. So the objectives for today, we're going to talk about what breast cancer is, um, the difference between self breast exam versus the clinical breast exams, goals of screening, a few of the recommendations for screening from some experts, risk factors for breast cancer, and some possible symptoms, along with some other things. So, again, my primary goal is to talk about checking yourself. So, you want to check yourself, of course, to protect yourself. So, again, my primary goal is. So, I'm sorry, let me go back here. Let me go back to slide series. Okay, so what is breast cancer? So breast cancer occurs when you have normal breast cells within the breast themselves that grow out of control. It's the most common cause of cancer within women. It's the second leading cause of death overall, only second to lung cancer. So breast cancer is the most common cancer for women. However, it's the second leading cause of death in women overall. Um, One in every 8 women will be diagnosed with breast cancer. As we learned a little earlier from Anna's presentation, that is if you live to be closer to 80. So it kind of like your risk factor get cut into half as you get older in age. That's why breast cancer is not usually found in as it's not really as common in the younger women as it is in older women. But however, don't be misled. It can still occur, of course, in younger women as well. Um, so please make sure that if you have more significant risk factors that you do get checked out if you're younger. And we'll talk a little bit more about that um, shortly. So again, we I'm sorry about that. I had computer issues. Sherry, can you hear me?
Yes, I can hear you fine.
Okay, perfect. So maybe that's why I wasn't advancing. My internet was giving me issues. So can we use this slide? Okay. So breast cancer is the most commonly diagnosed cancer, of course, in Black women. Um, so re- the reason why this is so important to me is that research shows that breast cancer affects Caucasian and white women more higher rates. However, Black women are more likely to die of breast cancer than our white counterparts. And we think that it has a lot to do maybe with access to care, maybe getting in to follow up and getting the screening. But again, we want to make sure that we are definitely getting into our appointments, getting our annuals done, and definitely getting to get our mammograms done on an annual basis when they're appropriate. So, what's the self breast exam versus the clinical exam? So, sometimes we call it the self breast exam or the breast self exam, however you want to talk about it. So, whether it's the SBE or the BSE, it's when you check your own breast on a monthly basis. So we encourage you to start when your menstrual cycles start. So yes, younger ladies, get comfortable with feeling your breasts when you start your cycles, because if you get comfortable with feeling your own breasts and checking them, your fingers, the pads of your fingers do create memory. Now this is controversial. Some people say that uh does it really help? Um so we do find there's been some studies on this that says that it didn't change the number of the number of mass found in women. However, some studies did find there was a positive decrease in breast cancer related deaths if women did them properly and also follow up with a clinical breast exam, which was done by a provider. Um, and additional studies, were done or workers within um, that time frame after finding the mass. And so there was a 40% chance of there being some type of correlation if they did, of course, followed up after finding the lump. So there could be some benefit to doing it. Again, it is individualized, so I do encourage you to follow up with the recommendations of your own provider. But of course, us in our Women's Health Center, we do recommend that you do your own self breast exam. So again, we encourage you to start after your menstrual cycles begin, and we recommend that you do it at the end of the cycle because your breasts are pretty tender during your cycle. So like within 7 to 10 days after your cycle, and you would just want to fill your breast up. So um, it's okay to, again, to get comfortable with filling your breast so that you can get familiar with how your breasts feel. Because for a lot of us, especially women of color, our breasts are a little lumpy, if you will. That's because of the fibrocystic changes, or a lot of our breasts become dense. So if you definitely get comfortable with the way your breasts feel, then you'll be able to pick up on irregularities or things that are different or shouldn't be there or that are inconsistent. Um, Also for women who are not getting menstrual cycles regularly, so whether you're in menopause or you have different type of birth control that you do not get regular cycles or different medication. Um, so a lot of the psychotropic medication that you may be on may not allow you to have a regular menstrual cycle, or some type of disease process like polycystic ovarian syndrome. You may not get a regular menstrual cycle. I typically tell those women to do the breast exam on the day of their birthday. So, for example, my birthday is November 26th. So, the 26th of every month, I will give myself a little present, so to speak, on that particular day of the month, just to make sure that I'm doing my exam on a consistent day each month, and I won't forget that day. So again, fill yourself up, do a little exam every day of the month, and we'll talk a little bit about how to do that a little bit later. So in the shower, it's best to do it because while you're in the shower, it's easy for your fingers to glide around the breast tissue so that you can cover all aspects of the tissue, including the outer aspect and the upper aspect of your chest wall, as well as underneath the armpits or the axilla. Also, you want to look in front of the mirror. You're looking for changes of the breast. As far as the skin changes, whether it's dimpling in, different discoloration of the tissue, um, differences in the size. Now, the breast tissue or the breast will tend to be slightly different. But this, our body tends to be slightly bigger on one side than the other. Our hand on one side is bigger than the other, as well as our feet. The same goes for our breasts, but it shouldn't be a big difference in the size. Then that would be concerning, because if it's a big difference, then it's possibly bigger because of a mass that's contained in that side of the breast. Also, you want to examine your breast lamb down as well, because depending upon how you're standing, sitting, lying, you will definitely shift your breast, and you could pick up on the changes or often find a mass depending upon how you're lying, sitting, changing as well. So again, this talks about how we're doing our breast self exam. Depending upon how big your breasts are, you may do it differently. Some people might go up and down if their breasts tend to be larger. A lot of people tend to do concentric circles if their breasts are medium or smaller size, but you definitely want to definitely make sure you cover the entire breast tissue. So I can't say enough about definitely touching yourself. And that's what we do promote. Again, some people, it is controversial. Some people do not recommend it, but others do. And I am a strong proponent of it because it definitely doesn't hurt to check. It can definitely um, help give us some helpful information. If you find something on your own, come into the office. We'll definitely be more than happy to definitely check over what you found yourself, and then we'll go from there as far as if we feel the need to order either a breast ultrasound, diagnostic mammogram, or go from there. So the clinical breast exam, or CBE, again, this is the exam that's done during your appointment by a healthcare provider, whether it be an advanced practice nurse or a physician of some sort, or a physician assistant. Um, it is usually part of the preventative exam or an annual exam. Sometimes we might do it in response to symptoms. So again, if you came in said that you had a lump or that you're having pain in that particular area, if you're having leaking from your breast, we definitely will do an exam of that particular breast. Again, it's part of the routine checkup, and then we will do order your annual mammogram. We do recommend yearly mammograms starting at the age of 40, usually, and that's recommended by two expert groups. And we're going to talk a little bit about the recommendation from the expert groups, and that's for the general population for women with just average risks. It's different if you have different risk levels, but generally speaking, for average risk women, the recommendation is starting at age 40, and that's based on two expert groups, and ACOG, the American College of Gynecologists and Obstetricians, which I follow their guidelines. It's one of them. So screening. Um, so screening looks at breasts for different people. Again, mammogram is the most common screening tool that we use. Um, we will do in the office either the clinical breast exam you do on your own, the breast exam, or the or your self breast exam or your breast self exam. Um, and then if we have any concern after we do either of the two, then of course we'll send you for more definitive screening or diagnostic mammogram. Early detection is the ultimate goal of the screening, so of doing the mammogram, because if we find the cancer early, as Anna indicated in her prior presentation, it's a high likely 92% chance of it being able to be um, giving us a high rate of cure. So we really want you to get in early because this doesn't have to be a fatality or a sentence of death if we get you in to get and catch it early. People who do not come in because they're afraid to find out what's going to happen or they're afraid to hear the diagnosis, then once we catch it late, you have a poor prognosis. So we definitely want to catch it more early. And again, African American women are more likely to die of breast cancer than our counterparts, even though they have a higher rate of breast cancer than we do. So early detection does save lives. Um, and so this is looking at what I was just talking about. Um, so again, our counterparts are Caucasian and other population are they have a 90% um, rate of survival than we do as African Americans. We only have an 80%. So we definitely want to change that and improve our survival as well, our 5 year survival rate. So 90% of women who find and treat breast cancer early will be cancer free in 5 years. So again, we want to improve our number and level it off with our counterparts, but we cannot do that if we don't get in and get our screening early as well. So recommendations from the expert panel. So again, ACOG, American College of Gynecologists and Obstetrician, as well as the American College of Radiology, do recommend screening for average risk women at the beginning of age 40. Um, American Cancer Society recommends between 40 and 44 years of age. It should be offered as a choice, but they don't necessarily have to start. So, um, again, they can start at that age, but don't have to necessarily begin it as an annual tool. Um, but between the age of 45 to 54, they do recommend it annually because the risk is increased. At 55 years plus, they could start getting it biannually and continue annually. It's up to them, depending upon their risk factors, and then continue thereafter, depending upon their life expectancy. So, if their life expectancy is 10 years or more, then definitely continue on biannually. However, if their life expectancy is less than 10 years, it may not be necessary, depending upon their mortality. And then again, the acronyms there, I put there ACOG and ACS as well as ACR. Those were the acronyms. So mammograms. A mammogram is a specialized X-ray that particularly looks at the abnormalities in breast tissue. We have different types of mammograms. We have a screening mammogram that we do just for women who are just going to get a screening. That means that they do not have any known risks. So they didn't present with a lump in their breast or some type of pain or anything like that, or any type of mass or something or lump that they felt. They're just going to get their routine screening. However, we do diagnostic mammograms for people who have a concerning finding. So maybe they felt a lump or something in their breast. Again, this is the most common screening test done to detect breast cancer. Again, as Anna alluded to, it is very cheap, I wouldn't say cheap, but very inexpensive, especially for the information that it gives. That is definitely life saving. It is less useful though in those who have a dense breast tissue because it doesn't give us good information. Um, Often women get scared because we come back telling them that they need to go for additional studies, usually a breast ultrasound, so that we can add information to that. And again, this is more so for women of color. A lot of times, women of color tend to have more dense breasts as well as fibrocystic changes, so more cystic breast tissue as well, which makes it harder for the mammogram to interpret. So often they need the mammogram as well as the ultrasound to correlate information to definitely say that the breast tissue, we have a good information to suggest that it's normal findings, and they don't need to have any additional studies at this point with the two tests combined, and they could just return to routine screening and just come back annually the following year. So this is a picture of a mammogram, how it looks. A lot of women say, "Oh my God, this is definitely not something that I want to do," and they're frightened by the thought of having a mammogram. The discomfort that you experience for the few minutes is worth the amount of information that we get to again detect breast cancer if you have it very early, so that we can cure you and that you could have a good survival rate than if we catch something later in time. Um, the compression that you have during the study does not last long. And as Anna alluded to, we now do the 3D mammograms. The compression that they have to do is still the amount of compression, but however, the time that they have to do it is cut shorter. So you don't have to experience it as long of a time frame, so at least it's shorter. And when I had my mammograms, the stories that I hear um, are not as bad as people claim them to be. I do have a higher pain tolerance. Everybody pain tolerance is different, but again, for the information that it provides, I will take that any day to just for somebody to tell me, "Oh, you're free of breast cancer this year," and again, I only have to get it done once a year, so I'd be happy to take that couple minutes and then go treat myself to Cheesecake Factory and just have a slice of cheesecake for having my mammogram. Um, Maybe I shouldn't have said that but if I only do it once a year, I guess having a slice of cheesecake once a year for having a mammogram is not bad. So mammograms do save lives. We want to make sure that we need to understand, because I get a lot of this all the time. What do I need a mammogram for? I don't even have breasts. I don't care if you wear a training bra. You still need to have a mammogram. You can still get lumps. They might be a lot easier to feel. However, there's some lumps that are harder to find, may be a lot smaller. But again, if we catch them earlier, you have a higher survival rate. So breast cancer does not discriminate. It likes them small or large, it doesn't matter. So we do want you to come in and get your mammogram if you think you're in a training bra, if you think you need a bra the size of, I don't know, that you could jump rope with it. But please make sure that you come in to get checked and get your mammograms. So risk factors. Again, if you had the take home message of this is the longer you've been exposed to hormones, your risk is greater. So if your period started earlier than 12, you're of course going to be more at risk. Um, Also, women, of course, are at higher risk than males, although males are still at risk for getting breast cancer. Again, it might be easier to find because they don't have a lot of breast tissue as we do, but again, it's they can still get breast cancer as well. Never having a child, because again, they um, are more exposed to hormones, because once we have the child, we're pregnant, we're not having the monthly cycles, it ceased for a while, versus a person who never gets pregnant, they're going to continue with their monthly cycles, of course, as well as having a child at an older age. Um, Again, your rate increases significantly when you're 40 and older. However, again, younger ladies can still get breast cancer as well, especially if you have first degree relatives. So that means your mother, your sister also have breast cancer. Again, you now are outside of that average risk and you're more at a higher risk. Menopause after 55 years of age, again, your exposure to more hormone, personal history of breast cancer or other problems, as Anna alluded to in her prior presentation. So, other issues with your breast that put you at higher risk factors. Again, I talked about the first degree relative with breast cancer or other female cancer. So we're talking about uterine cancer or ovarian cancer. That's why that's so important that if you have a family history of that, you let your provider know. When women come in and talk to me, I'm asking them specifically about those female cancer, breast, uterine, ovarian. Those are so important to know about. And again, especially in your mother or sister, but we also want to know about your extended relatives too, and that's on both sides of the family, so paternal as well as maternal. So it's very important that you know your family history. I get people in the office a lot that do not know their family history, so please start to talk about that. That's very important to ask your mother, your father, as well as to ask them about your mother when she went into menopause, because often daughters mimic their moms, so that's important information to know. That's a little off point, but that's still information to know. So again, other risk factors, genes. So the BRCA1, the BRCA2. Again, Anna talked about that more in detail because she will talk about that more um, as far as what she do in the breast clinic. But again, that puts you at higher risk, as well as oral birth control pills. I don't want people to think that birth control pills aren't of great benefit, but definitely just be aware that they can pose some risk factors. However, again, you can not be on birth control pills. You could eat healthy. You could not have anybody in your family that has breast cancer, and you could still have breast cancer. So we just want you to be cognizant of some of these risk factors. Also, being on hormone replacement therapy, again, being exposed to more hormones, radiation to the chest or the breast, especially if it occurred as a child or a teen. Overweight, especially when menopausal, because again, when you're overweight, um, the fat cells turn on um, some type of link that increases your risk for the hormone to basically affect the fat cells and basically put you at more risk for having breast cancer. And also your social history. So those who drink alcohol or smoke cigarettes definitely put you at higher risk for developing breast cancer and also with metastasizing. So just being aware of that as well. So I talked about the BRCA. So what does BRCA mean? The BR is for breast, the CA is for cancer. So everybody does have a BRCA gene. It's just for sometimes some people have that gene that does turn on and then doesn't mutate, and that's what puts them at risk for it. So if for patients who want additional screening for that, especially if they have family history, I send them to the breast center, and then Anna can evaluate you, and then talk about and discuss your risk factors for that, and discuss the possibility of testing for it. So about 70% of women diagnosed with breast cancer have no risk factors at all. So we do have some women who show up, don't have any family history, don't have any risk factors, and do end up having breast cancer. It can sometimes be some type of environmental link. Sometimes it could be a mutation. Um, Sometimes it's no explanation. So again, we definitely get those women over and get them into treatment. That's the first thing. Anna talked about this again, risk factors that you can control versus risk factors that you can't. So again, those risk factors that you that we can't control would be our genes. So sometimes we would like to change people who are in our family or our family members, but of course we can't. We would like to change our sex, but we can't. I mean, well, some people they can, of course, but um, even though predominantly if you were born female, you always have those underlying genes and those risk factors. And even if you are male, you are still at risk for having breast cancer as well. Um, you can't change your age, of course. So those are the risk factors that we can't change at all. But we can change our diet. We can start to move. We can exercise. We can stop smoking. We can watch how we drink. So those things, those factors, those what we call modifiable risk factors, we can control versus the non-modifiable risk factors. So symptoms. So some of the symptoms that we might feel is again a lump, a nodule in our on our chest or in our breast or under our armpit. Again, swelling or the thickness in the area of the breast. Again, one breast might appear to be more heavier or more larger, significantly larger than the other. Skin changes like dimpling or even that rough skin peeling or enlargement that looks like an orange peel. That is definitely significant and related to a specific type of cancer. Nipple changes, so redness, flaking, pulling into one direction or pain or discharge, especially if it's real dark, bloody, or black. That is definitely significant. White or yellow is not concerning. Um, Changes in size or shape. Again, we talked about that, and definitely we're less concerned about um, tenderness, but if it's a significant new pain, especially if it's a large, that might be concerning. It might cause for you to come in and just check it out. Um, Sometimes, again, if it's a large mass, sometimes it may cause some issues, especially if it's in the area of a nerve. So this was some of the things that I just talked about, just going over some of the same things. And that's another pictorial of it as well. So this is just a fact sheet, just summarize some of the things that I already talked about. Again, it's the leading cause of cancer deaths in the world for women, but second leading cause, second to lung cancer. Um, every 2 minutes, a woman is diagnosed with breast cancer in the U.S. Now that's something significant. So again, we want to definitely keep the lumps out of our cup. In our coffee cups, it's fine, but not in our bra cups. So early detection definitely will help to reduce that. So these are some of the resources that you could go to. Um, I like people to utilize resources, but I want them to be something that's more useful. So if you go to .org, .gov, those are something that you could definitely depend on. Um, I, when people just go to Google, and I say you go to Dr. Google, sometimes you just plan your funeral, but you don't get information from reputable resources. So I definitely want you to use sites that are like .gov.edu, I mean .org.gov.edu, because those are more reputable. Um, so here are a few, and again, you could use some .edu sites as well because they have more factual information as well. So big or small, we want to say them all. So again, if you say that you have small breasts, nonetheless, we do, you can still have breast cancer. And this is the time that I'm gonna open up for questions. Sherry, do you have any questions, or do we have questions over Facebook from the live stream?
No questions so far, but I'll double check just to make sure. There's a couple of questions I have for you because I see a couple of who's watching are actually men. For
Oh,
what you do, I know you're a wife, and you primarily focus on women. What advice do you do any screening for men? Is the screening process the same for men? Do you should they still feel their breasts like we do?
So it's a little bit different for men. Of course, I work in again women's health center, so um, I don't think any men would even want to check in or make an appointment for me, but they wouldn't be able to make an appointment to see me in my practice where I'm at Metro Health. But they will be seen in either internal medicine, typically, or family practice. And if they have any concerns where they would either have a high family history of it, or if they felt something in their chest area, then of course they will discuss that with their provider. And then after that, then there will be discussion and of course an exam and then follow-up studies thereafter.
Sounds good. And I encourage anyone who's watching to post any questions you may have for Miss Lavada online uh, in the watch party or either in the live stream on Facebook. And I'll post the questions while we're currently going live at the moment. But Lavada, another question I have for you, um, and I know this may be crazy. Why does alcohol increase the risk of breast cancer?
So things that we do like tobacco, alcohol, they are definitely they affect overall our cells in our body as well as our immune system, and they basically allow cancer to grow rampant. Because again, when we talked about these cells, they are overgrowth of abnormal cells. So when our immune system is definitely down, our defenses are down, then these cells can definitely basically just grow out of whack. So we don't want to do anything that's going to definitely impair our immunity in our within our body. And overall, people who smoke, they're at risk for developing lung cancer, and lung cancer is that could be a secondary cancer, and that can also pose risk for metastasis. I know that personally, um, my aunt, she had breast cancer. She was the only person that had breast cancer in our family so far, and it was my mom's sister, so my maternal aunt, and she had breast cancer, and she was surviving breast cancer. Went back for a follow up for that. And on follow up, her provider was listening to her doing an exam at Metro. Metro was an awesome place. Didn't like what he was hearing on the exam, sent her to the emergency room, and they found a large mass in her lungs. Now, my aunt never smoked a day in her life, but she lived with her husband who was a smoker. So, because of secondhand smoke, she ended up developing a secondary site, and that's what took her out, not breast cancer but lung cancer. So I just want to use that as an example for people that yes, it is true that if you do tobacco, alcohol, it definitely can, especially if you already have a weakened immune system, can definitely impair you even more and put you at more risk and definitely cause some mortality. Whereas she probably would have had a great prognosis had that not been the case where her immune system was already attacked.
Oh, thank you. I'm so sorry you went through that. My thoughts and prayers are always with you and your family.
Thank you.
So, how early would you recommend someone, a girl or even a guy, how early, what age do you think we should start our breast exams?
So again, for young women, we do recommend self-breast exam at menarche. So that means that the first when they first start having menstrual cycles, a lot of women do not want to do that, and that's fine. You know, some of them forget, some of them are not comfortable with touching their body, and I do get that, and I do appreciate that. Again, we can encourage. Um, some of them may do it, but may do it irregularly. Often I say, hey, and this is where the guys end up loving me. You know, I try to get everybody involved. I say to the ladies, well, hey, if you don't like it, have your partner do it. Make it a, a thing where each, let him do it. He might do it anyway. So, make sure make sure everything all together and okay. So for guys, again, if you for guys, it's a little bit easier because they don't have as much breast tissue there, so it might be a little bit more apparent, um, or it might be as Anna said, more superficial. So they might feel something that might be pulling or a little lump there. So it might be easier to feel. And especially, I would say, if you have a family history, a strong family history of men who have breast cancer, then they will definitely want to check monthly. And they may want to start doing it at least 10 years before that person was diagnosed.
Very good question. Thank you, thank you, thank you. Um, so your counterpart, we for those of you who have listened, we had a part two of this, if you will. A nurse practitioner who actually works at Metro Health with Lavada, is her counterpart. So whenever Lavada finds a suspicious lump, she refers them over to the breast center. And we just had Anna Persis do a presentation about the screening and the treatment of breast cancer. And we're going to have them both back soon to talk about the risk factors and how we can change our lives a little bit, do a little bit of life changes, changes in our behavior to help minimize the risk of us getting breast cancer. And of course, Lavada spoke to some things that we can't change. We can't change our race. We can't change the fact that we're a woman. Even though some may go through procedures with those genetics built or infrastructure that still reads women a woman. And there's other factors that we just can't change. We can't change our age. But one thing that you did point out, Lavada, and just the importance of early detection, it is extremely important. And just because you feel that you don't have those risk factors or a family history of cancer, or you don't drink or you don't smoke, and I'm just going back to your list of risk factors, because as you were talking, I was thinking about all the risk factors that you spoke about. And, I was diagnosed at 32, and most of those I didn't have.
Right,
The only
right,
that I was, I'm a woman, and I think I started my menstrual when I was 11. So out of this list of 7 things, only had 2. So just because you may not feel like you have a lot of risks, you can still have it.
right. And
Um,
as I said, you don't have to have any other risks other than being a woman, and you can still have it. Um, so yes,
yeah, as it comes anyway. And also too, then I went on and looked. Yeah, I was taking birth control. I didn't do any hormone replacement. I didn't have radiation. Of course, I'm fat. I still be fat. That.
I would say that you're fat, but
Yeah, and I wouldn't even consider myself a social drinker. But we just have to be conscious of ourselves. We have to be self-aware. And when you know something is wrong, a doctor or someone tells you, I don't think that's, the case, you don't have anything to worry about. Listen to yourself and your body and get a second opinion. Is that something you will recommend? What is your take on it? Do you get a lot of people coming to you for second opinions?
so I say it's. I mean, everybody is always welcome to get a second opinion. I even say that even for people who comes to me, you're always welcome to get a second opinion because I'd rather you be confident with the information that you're getting and be able to sleep at night um, by getting a second opinion. Um, so everybody should definitely get a second opinion. Um, it's okay because this is your health and we want you to be an active participant and it's definitely have an active role, so it's definitely beneficial to get a second opinion. The other thing to that, I just want to clarify, um, when I say alcohol and tobacco, I mean somebody who is regularly smoking on a daily basis and definitely drinking. So not just a social. I go out once or twice a month and I may have one drink or something like that. I'm talking about somebody drink like on a daily basis or like 3 or 4 times a week or weekly basis, something like that. But social drinker, not. We're talking about somebody who is basically alcoholic.
All right, sounds good. Drinking enough to impair your immune system. Okay,
Right.
excellent. So if any one of our listeners or our viewers wanted to get in touch with you because we have a suspicious lump or someone in our family have a suspicious lump, um, how do we get in touch with you?
Well, I would like somebody to again my unlike Anna, I actually push preventative care. So I like to see women before there's an issue. So I like you to come and see me on at least a yearly basis. So at least once a year just to make sure everything is going great. So I like to see you for routine care, preventative care. My office number is 216-778-4444, and you can schedule appointments. I accept patients. I accept patients for well woman care as well for obstetric care. So if you're pregnant, family planning, birth control, all your gynecologic or women health needs, I definitely accept all patients. However, if you have some issues, of course, we will address those too. And if it's outside of what I do, I definitely will direct you to the appropriate places. Like I said, if it's more concerning or if you have an issue with your breast, then that's when I do a referral to Anna. But I address again, your preventative care needs because she doesn't do that in her office. She doesn't do like birth control. She doesn't do your PAP or anything like that. That's me. She's going to send you right back to me for that.
Sounds good. That's not a problem at all. Well, we definitely appreciate your expertise in this, and we're looking forward to all the fascinating things that you're gonna, pursue in your own personal career and being the health and wellness director for My Sister's Keeper Cleveland.
Yes, I'm excited.
I can't wait as well. So Lavada, just to introduce everyone to Lavada again, she's a member of My Sister's Keeper Cleveland board and our health and wellness director. This program is actually brought to you because of Lavada's work. And we're looking forward to seeing more fascinating input just to help minimize the reduce of cancer. We want everyone to live happy, healthy lives. And part of doing so is being aware of who you are, being aware of your body, and going in soon as you feel like something is off. So if you have any questions or comments, please feel free to reach out to My Sister's Keeper Cleveland, or you have Lavada's information that she provided for us. My Sister's Keeper Cleveland, you can reach us at 216-333-1819 or via our website, which is mysisterskeeper-cle.org. You can also find us on Facebook and on Instagram. Shout out to our host for sponsoring this website or this live stream, Chan Clan Radio or Chan Clan Entertainment. We typically do live uploads, or you can find us on Chan Clan Entertainment Radio. Our sessions are pretty much streaming every Sunday at 11 a.m. Again, Lavada, I don't know what we would do without you. Thank you so much for being a fabulous person that you are. And we'll be looking forward to part 3. Huh?
I said back at you.
So we're looking forward to part 3, and this will be Lavada coupled with Anna Persis.
Yay.
About how to reduce the risk factors that we can control. So stay tuned. Again, if there's anything we could do to help, reach out to us. And you all have a fabulous evening.
Yes, thank you for joining us. Bye-bye.